Hello, everyone, and welcome to the first episode of Tea Time with Tara. I'm Tara. Since this is my first episode, I wanted to share a little bit about me first. Soy Boricua. Both of my parents are Puerto Rican. I was born in Harlem, but I grew up in North Jersey. I am 35. I just turned 35 last month, September, so I'm a Virgo. I'm also a single mom of an almost 4-year-old girl and an almost 15-year-old boy. My son's biological dad, or as I sometimes refer to him, a sperm donor, he has not been in the picture in the last 13 years as of this month. I became a mom right after I turned 20. So I was 19 my entire pregnancy, and I have been a mom for my entire adult life. I lived in Orange County, New York, with my son for most of his life, right up until 2019. During that time, I met my daughter's father, and we got together in 2014. We were married in 2017, and then we separated in March of 2020. Our divorce was just finalized in May of this year. Woohoo! And a little about my podcast. I will be talking about all kinds of topics. I want to focus on the human experience and human connection. I'll be covering topics such as trauma, parenthood, relationships, sexuality, mental health, and many, many more. This episode is about ADHD. Since October is ADHD Awareness Month, I'm recording this in October and thought it would be a good time for me to talk about my recent diagnosis, as well as how it impacts my life. I'd also like to introduce everyone to a very special guest today. She is going to be assisting me with some of the fact finding. Alexa, say hello to my listeners.
Hello, listeners.
Alexa, what is ADHD?
According to Mayo Clinic, attention deficit/hyperactivity disorder, or ADHD, is a long-term condition that affects children and adults. Most kids have trouble paying attention or are hyperactive or impulsive at times. If a child has ADHD, the symptoms start early in life and create ongoing, significant problems at home and at school. Kids with ADHD may struggle with self-esteem, relationships, and school performance. Treatment includes medication, skills training, and talk therapy. Early diagnosis and treatment can make a big difference in outcome.
Thank you so much, Alexa.
You're welcome, and thanks for the continued thanks. You just made this AI's day.
I'm glad I could do that for you. Okay, so that was a pretty good overview of what some of the symptoms are. I was just diagnosed a few months ago, right before my 35th birthday. I would say it's probably been about 6 months or so. I think a huge reason why it took so long for me to be diagnosed was because of the fact that I also suffer from anxiety. I have spent basically my entire adult life just trying to overcome my anxiety and PTSD symptoms. I feel like it took me probably, it was probably over a decade in order for me to find the right medication to treat my anxiety. I would start one, it would feel awful, and I would get off of it, start another one, try again. And I did that a few times. I feel like it was probably 3 or 4 cycles of that, with a few years in between, until I felt like I was going to lose my fucking mind because of how bad my anxiety had gotten. It felt like there was a hand squeezing my throat and there was pressure on my chest. This was something that I experienced all day, every day. It wasn't something that ever went away. And that's why I was so desperate finally to get the treatment and to find something that really worked. I had already been in therapy on and off again since I was probably about, maybe 11 or 12. But therapy alone isn't enough for something like this, especially when you don't have the right therapist. I think that having the right therapist is a lot like finding a good partner in a relationship. You're going to have to shop around. If it doesn't feel good, it's not going to work. If you guys don't click, you're not going to get what you need out of the therapy. Same goes with your psychiatrist, to be honest. But try to remember that sometimes it could take a few tries to find the right therapist, and there's nothing wrong with that. And you don't need to feel guilty about ending your relationship with your therapist because just like in dating, you don't owe anybody shit. One of the things that I recently learned about was that anxiety is actually a comorbidity of ADHD. Alexa, what's a comorbidity?
A noun, comorbidity, can have a few meanings. 1. The presence of one or more disorders or diseases, in addition to a primary disease or disorder. 2. A disease thus coexisting. 3. The effect of such additional disorders or diseases.
I had no idea. I mean, I was kind of blindsided by it, to be honest. I was so focused on getting my son his own diagnosis, feeling like a complete train wreck because of how severe my anxiety was. And it didn't even occur to me that it was a possibility for me to have ADHD. Once I got my diagnosis, I decided to speak with my psychiatrist about trying medication. And one of the things that I felt like was pretty important to me at first was not jumping straight to taking stimulant medications. I think a part of me was afraid that getting on a stimulant medication would make my anxiety worse and kind of counteract the medication that I'm taking to treat my anxiety. I didn't want to end up taking a step backwards. But I think that another part of it was also that there is such a stigma associated with taking stimulant medications because so many people abuse them. People who don't need them take them. I spent a few months trying different medications. The first one that I tried was Strattera, which is the brand name for atomoxetine. That felt awful. I had the worst dry mouth. I felt like I was going to pass out every time I stood up. I feel like there were a lot of other symptoms that impacted me every day, but those were the two major ones. I felt like no matter how much water I drank or if I chewed gum or whatever, that dry mouth feeling was absolutely miserable. And having to remember to slowly stand, it just felt fucking ridiculous. Then I moved on to Wellbutrin, which is also an antidepressant. I did some reading and apparently it has been used as an off-label treatment for ADHD. That didn't seem to do anything for me. So the last one that I tried was guanfacine or Tenex, and that one also didn't seem to do anything. I mean, it was a really low dose, but you only take that in small doses. So I'm not really sure. Regardless, once I felt like I had exhausted all non-stimulant options, I spoke with my psychiatrist and then I spoke with my primary care doctor and we came up with a treatment plan. It just started about a month ago. And so far, so good. I started taking Adderall and I'm noticing a difference. All of that to say that if what you need to have a better quality of life is to take some meds, even if they're stimulants and people have certain feelings about them, fuck them. Are they paying your bills? Are they taking care of your kids? Are they doing your shit for you? No. So do what you got to do for you. There are so many things that I didn't realize that were symptoms of ADHD. And I feel like every day I'm learning something new. It's so crazy once I started to realize that every part of my life is impacted by the fact that I have ADHD. I want to talk a little bit about the symptoms that I know that I am experiencing that are associated with ADHD. The first one for me is struggling to complete tasks. I'll be honest, I even have a hard time initiating tasks. Both of those things are symptoms that I experience on a day-to-day basis. I'll become so overwhelmed by the idea of doing something and what it takes to do something that I become paralyzed by it. And I call that overanalysis paralysis. I deal with that all the time in so many different aspects of my life. I experience it with work, and I'll get into my struggles a little bit later on with work, but overanalysis paralysis is huge. At this very moment, I know that I have 2 baskets of unfolded laundry sitting in front of me. And guess what? I'm doing my podcast because that's a whole lot more interesting and gratifying. Fuck yeah, dopamine. I found a pretty cool article about what ADHD is and the symptoms, etc. I will share that article link in the show notes, but I do just want to give a quick shout out. This is not sponsored, but Attitude Magazine has been a huge help for me. It's been a fantastic resource in learning more about ADHD. Originally, it was recommended by a family member that I check it out because of my son and his previously undiagnosed ADHD, but it has helped me so much. I've attended webinars, things like dealing with the clutter, and even things about getting into certain types of relationships, which I'll be talking about on a future episode. The biggest takeaway from that article was a really simple definition of ADHD, which is that it is a developmental disorder of the brain's self-management system. So as much as I love to manage shit and be a leader, I apparently can't even manage my own fucking brain. Anyway, one of the things that I struggle with as far as forgetfulness and losing things, I lose my car and house keys all the time. I used to have 2 separate air tags on my car keys and my house keys because I do like to separate them so that I don't have a ton of keys on one chain. But that didn't work out. I lost one of the air tags because I got some stupid fucking shitty keychain to hold it. Anyway, I wound up with this gigantic carabiner clip, and I now have 1 air tag on my keys. But using that air tag has been a lifesaver because there are so many times when I'm trying to leave the house and I can't find my keys, or I can't find my glasses. And both of those things are kind of necessary. Like, I can't fucking drive without my keys, and I can't fucking see without my glasses. What's stupid about the glasses thing is that I have probably, I want to say I have more than a half dozen pairs of glasses because I buy, like if there's a pair or a style that I really like, I'll buy a couple of pairs of them. So they're everywhere. And the fact that I still can't fucking find a pair of glasses when I'm trying to leave the house is absolutely absurd. I try not to wear them all the time when I'm home because I don't need them to see up close, but I certainly shouldn't be driving without them, especially at night. If you see me without glasses at nighttime, get off the fucking road, get out the way, send help. Because I don't like wearing contact lenses. They feel awful. And I especially wouldn't be wearing them at night. With my phone, I'm always listening to podcasts or music with my headphones on. And since they're wireless, I'll put my phone down somewhere and I'll completely forget where it is. Thank goodness for the feature of Find My iPhone on my Apple Watch and, well, just in general, that feature, because it saved me so much time and frustration. I love technology. Another thing that people with ADHD can struggle with is paying attention to small details. That is like making careless mistakes. I think that really manifested more for me in elementary school and high school, especially in math class. I fucking hate fractions. Do not ask me to help your child with fractions. I already told my own child, dude, I cannot help you with that. Fuck that. Can't do it. It makes my brain melt. I'm not a bad mom, I swear. I'm just honest. But seriously, careless mistakes is a huge thing. And I am getting better at that. I think especially being in a career where I was previously in quality control, quality assurance. Now I'm a technical writer. I really have to pay attention to details. It can be easy still to overlook certain things. And it's usually really small little mistakes that are made, but it's not nearly as bad as it used to be. Another symptom that I experience is being really distracted when people are speaking to me. And I'm talking, somebody will be speaking directly to me. I will be looking at their face. I will be watching their lips move. They'll be talking to me, and I'm not retaining or absorbing anything they're saying. I actually have to ask people to repeat themselves. And it's not like I'm looking somewhere else or hearing something else going on, although that will make it 10 million times worse, of course. But yeah, I know that it probably seems really rude and that I don't care, but it's really just that I can't help it. when I'm reading, I struggle with retaining the information that I'm reading. One of the things that I've learned that helps me is listening to audio and reading it at the same time. So whether it's textbooks in school, which thank goodness most of the textbooks at my school have the audio option. I know that there are also apps that I can use and things like that. But even on TV, I am one of those annoying people that has to have captions on, or I have no idea what's happening and I cannot remain focused. Maybe that's why I don't like going to the movies, or like I don't really remember what happens in movies in movie theaters. It's probably one of the reasons. Okay. Well, struggling to manage clutter is another huge issue. As I was just talking about, I have two big full baskets of laundry sitting right in front of me, waiting to be folded. And I hate folding laundry. It's my least favorite chore. I want to pay somebody else to do it. Does anybody want to? Never mind, can't afford it. If anybody wants to volunteer to fold my laundry, I will grace you with my presence. Lucky you. With that being said, though, I do have to say, since I started taking Adderall, even though I don't notice an enormous difference, I definitely notice a difference in my ability to keep things tidy, to clean up after myself and the kids right away, rather than just kind of moving things from one place to another. Keeping surfaces cleared is a really big issue for me, and I'm doing a whole lot better with that. That feels so nice. Like being able to walk into a room and not be overwhelmed by all the clutter, all the stuff all over the place. It's amazing. And so I decided that I would start doing a purge and getting rid of all the stuff that I don't use, all the stuff that I don't need. I did a lot of donating of clothes. I think I donated like 4 or 5 garbage bags of clothes recently. I gave my sister a bunch of clothes and toys for my niece. Or was it books? Yeah, I don't know if I gave her the toys. Ugh, whatever. Anyway, it's really hard to manage the clutter. It's really hard for me to get rid of things. And now that I'm on the right medication, I've definitely taken a step in the right direction. I definitely struggle to manage my time properly. And that means I struggle with estimating how long it's going to take to perform a task. I think part of that is because of the fact that I get distracted. I have trouble sustaining focus. So I might be able to give you the amount of time that it would take in an ideal situation, but 9 out of 10 times, that's not accurate. That means I'm also late all the time, which I fucking hate. And it's so embarrassing. That's the one thing that I still really beat myself up over, I feel like, because I have not figured out how to not be late. It's either I leave the house 15 to 20 minutes after I'm supposed to, or I get ready, I sit down, and I don't do anything else until it's time for me to do whatever it is that I'm supposed to be doing. There are times when I feel like I lose time. I've recently read about time blindness, and I think that that's definitely something that I experience because I have almost no concept of time. I will feel like, for example, I'll do my nails. I end up spending hours and I feel like I haven't done anything else. And I'm like, where the fuck did all that time go? I was just doing my nails. And it's because I get so hyper focused on that one task and I get weirdly perfectionist about it that it takes me 10 million years and I've lost a bunch of productive time that I could have been doing something else. It makes me crazy. In addition to issues with managing my time properly, being forgetful is a huge issue. Historically, I have struggled with keeping appointments. So now that I constantly have my phone on me, again, yay, technology, anytime that I find out that I have an obligation, I put it right in my calendar. Anytime that I make an appointment, I put it right in my calendar. And I'm talking while I'm still standing at the receptionist's desk, I am entering that shit into my calendar with a reminder. Because if it doesn't go in my calendar, chances are I'm going to forget. As a matter of fact, just the act of putting it in my calendar is kind of like writing it down and it helps me to remember it. I have now become the go-to person for remembering when something is. With my partner, he's in a couple of bands. He has so much stuff going on and I end up part of it's because I'm just a planner, and being a planner is definitely a trauma thing. So I'm not going to get into that. But he tells me that something's going on. I'm like, okay, what day, what time, where? And if I don't have all that information, I will at least put it in my calendar and then go back to it later. Because once that event is in my calendar, I'm going to see it there and I'm going to remember that I have to ask for the details. I'll even put plans with my friends in there. And it's specifically because life is crazy. I have way too many things to keep track of. And if it doesn't go in my calendar, I'm probably not doing it. Sorry. Speaking of sorry, another thing that I do that I'm sure makes me seem like a really shitty friend, it is related to forgetfulness. And that is forgetting to respond to text messages. Once I open it, if I don't immediately respond to it, I'm going to forget. I really do my best to not open text messages until I can actually read them and respond to them. But I'm weird and don't like having unread notifications. I don't know. It's seeing that little red dot there with the number totally freaks me out. I can't handle it. I have to clear it. The same goes for work emails. But with work emails, it's a little easier because I can just mark it as unread. And those things, I mean, I'm constantly getting emails all day long. So having unread notifications in my inbox is an indicator to me that I need to look at something. I've also started to strategize and make to-do lists, and not like a typical to-do list where it's like, okay, you're going to go do this, then you're going to go do that. No, it's you're going to do this, and these are all of the steps involved in doing that, including the first thing, which is getting it started. Being able to do that at work has been fantastic as long as I can keep up with it. Because if I get really overwhelmed or priorities change and my to-do list changes and I don't feel like I have the time to react to it, I can kind of spiral and I completely fall off, stop making those lists, and my shit just gets all fucked up and I end up falling behind, not knowing what the hell I'm doing, struggling more with overanalysis paralysis. It's exhausting and it's frustrating, and it's one of the many ways that I feel like I'm constantly failing. I know that my brain works differently, and knowing that helps me to strategize rather than beat myself up. But at the end of the day, when I'm really struggling with something and I feel like, why can't you just get this right? Why can't you just do this one thing? It seems like such a simple thing. Just do it. That's when the self-loathing type of feelings start to set in. That's when I feel like I'm never going to be good at anything. I am always going to be looked at like a lazy, disorganized, hot mess express. And I don't want to be that because I have a really great work ethic. I really care about my work. I have a lot of integrity in what I'm doing, no matter what it is that I'm doing. And for anybody to have the perception that I don't have integrity and that I don't care because of things that I'm struggling with that they don't know about is so humiliating and frustrating. And I don't even know how to deal with that, to be completely honest, because telling somebody that you have ADHD, to some people, it might seem like an excuse. Some people don't really understand what it is. They don't understand that it's a neurological disorder. So I feel like in that way, I'm really struggling to find a balance between sharing that with people so that they understand where I'm coming from, but also not having it seem like I'm just using it as an excuse. And it's definitely not an excuse. I feel like there's something about knowing that this is just how I am and accepting that this is how my brain works and I'm not going to be like neurotypical people in certain ways. It feels so liberating, especially because I'm not actively working against myself anymore. That is such a huge relief. One of the interesting things that I've been learning about is that even though what causes ADHD hasn't really been determined yet, it seems evident that there is a genetic aspect to it. And my family is definitely evidence of that. My sisters have it. My son was diagnosed with it. My mom has not been officially diagnosed with it, but she most likely has it too. There are so many things where I'm like, now that I know more about ADHD, I'm like, Mom, you totally have it too. My daughter probably has it too. She's experiencing a lot of sensory processing issues and what appear to be behavioral issues. She has a lot of symptoms that point to that being a really strong possibility. She just had a sleep study done, and although she has mild sleep apnea, the bigger issue is her involuntary limb movements all night long. So that's waking her up. And there is a link between low iron and those like restless leg type movements and those types of syndromes. But apparently, low iron is also associated with ADHD as well as low vitamin D. So take your vitamins. I often refer to my kids as agents of chaos because I feel like right now there is a slothicorn. Yes, a slothicorn, a sloth unicorn sitting on my floor. There are teenage boy socks lying on the floor right next to the slothicorn. I'm trying so hard to keep up with my own shit, and they just make it worse, let's be honest. So they're my agents of chaos, but I'm also realizing that I am the OG agent of chaos. Damn it, it's the family gift that keeps on giving. All right, what other things? Fidgeting, yeah. I actually have I call them squishies, but they're little stuffed animals filled with beanbag thingies. They're soft and fuzzy, so they feel nice to touch, but they also feel nice to squeeze. And rather than tapping a pen or tapping my fingernails on something, I will occupy my hands with something soft because in addition to being able to just have that stimulation of touching something and moving my hands, I'm also not being disruptive because they're soft and quiet and not really obnoxious. I can do it right under my desk, for example, at work, and nobody has any idea that I am holding on to a fuzzy jack-o'-lantern. I also can't sit still. I really struggle to keep going back to going to the movies. That's a thing that I had no idea that there were all of these reasons that I don't like going to the movies are related to my ADHD symptoms. I don't like sitting still. I don't like how restricted I am in these strange seats in a very dark room. I have to move my legs a lot. I often like to sit with my legs up or my legs crossed, and not ladylike crossed. No, I sit like a toddler, crisscross applesauce, even in the fucking bar on the bar stools. If that shit's big enough for me to sit crisscross applesauce, that's what I'm gonna do. Otherwise, I'm gonna stand or I'm gonna find a bench and then I'm gonna sit the way I want. I am a child. I am just an adult child. What else? Interrupting conversations, speaking of children, because children are really good at that. But apparently, so are people with ADHD. When someone is talking, I will interrupt them. You can expect if we're having a conversation, or even if you're having a conversation that I'm standing by, I'm going to interject because I'm not trying to be rude. I am not trying to be rude at all. Please don't ever think I'm trying to be rude. What's really happening is that I have a thought. I have an idea. I have words. And if I don't get those words out of my mouth, they're going to disappear. And then I'm going to be really frustrated because I had words and then I lost them. And that happens all the time. I think another thing that I experience is I'll be in the middle of doing something. I'll be in the middle of saying something and I'll forget what the fuck I was doing. It's so embarrassing sometimes because I'll be talking to myself and I'll be like, okay, what was I doing? And I have to backtrack. I've gotten really good at backtracking, and it's not so much about looking around and trying to figure out what it was that I was going to do, but going back to the last thought that I had, because that last thought that I had is going to be what sent me to do this other thing, most likely. I don't know if that's an impulse thing or what that is, but on the topic of impulsive, I don't really have too many impulsive behaviors. I think that the biggest thing for me is impulsive spending. Unfortunately, that's something that I have really struggled with. And that's really frustrating because I'm like, I need this. I have an idea. And especially with shit like Amazon now, where you can order something and it appears at your doorstep sometimes like the next day. That shit's so convenient. But the reality of it is, just because I want something or just because something would be convenient to have does not mean that I fucking need it. And so I have to be like, yo, bitch, chill the fuck out. Get that out of your shopping cart. Save it for later, at least, you dumbass. Don't spend your money. You don't have money to spend. And sometimes that rational voice of mine still loses. Ugh, yeah, I hate it. I really hate it. Well, this is funny. The next thing that I have in my notes on my list is social awkwardness. And here I am. Here I am overthinking how I'm going to transition from impulsive spending to social awkwardness. There it is. There's a segue. I don't fucking know how to do those kinds of things. I feel really weird around people. I feel like I'm constantly in my head. I feel like I'm always saying the wrong things, or I just am judgmental of myself and am so worried about saying the wrong thing or doing the wrong thing. But on the flip side of that, I'm a complete asshole. I thought that it would be a good idea to approach this dude who seemed like somebody that I would probably get along with and tell him, hey, you look like a douchebag. Yeah, yeah, I did that. I am the worst. Ugh, God, that didn't go so well, but we turned it around and I think that we're cool now. I hope. Another thing about social awkwardness and being around people is that I really struggle with getting up the courage to go somewhere where I know that there are going to be a lot of people, especially when I know that there are going to be a lot of people that I don't know. I feel so uncomfortable and sometimes I get full blown anxiety. I'm talking the other day, my partner and our friends and I were all going to go to a party. It was like a Halloween thing. Sounded really cool music, dressing up, drinking, fun. But when I started to think about the act of going and being in this event that I knew nothing about, that I knew that I was going to be around a bunch of strangers, I didn't know how many people were going to be there, I had very little information, I started to have a complete panic attack, and it got so bad, it physically felt like my heart was pounding out of my chest. So in order to pull myself out of that, well, I was also really tired because I think I stayed up way too late the night before, and I don't know what sleeping in is. But I said, dude, you cannot make any fucking decisions right now. You need to go the fuck to sleep, clear your head, and figure this shit out in a little bit. So I put some chill music on, I put on Halsey, love them, and then I took a nap. It was like a 45-minute nap. I woke up, felt kind of disoriented, but felt generally good. And then I was like, all right, now I can talk to my partner about what we're doing. Thankfully, we didn't go. I had a really nice night anyway, but that whole bullshit leading up to it is a really common occurrence for me. It's part of the reason why I overly plan things, because I feel the need to be in control. I don't like when there are unpredictable or unknown factors. I don't think I talked about my weird OCD behaviors. And I say weird OCD behaviors because I don't think it's OCD. And I just think that they're weird behaviors. And I joke that I am obsessive compulsive about really dumb shit, like how the utensils face in the drawers in the kitchen. If they are not all facing a certain way or all placed in the drawer a certain way, I will actually go back in there and reorganize everything because they have to be just so. How I organize my clothes in my closet is another thing. If they are not organized by sleeve length, for example, there's a whole method to the madness. I have to have things a certain way in my closet too. The last thing, and again, fucking laundry. Ugh. Ugh. I hate folding laundry. And part of that has to do with the fact that I'm very particular about the way that things need to be folded. So it takes me a really long time to do it. And then it never fucking gets done. And it's this constant cycle of me drowning in unfolded clean laundry or waiting to do the laundry because I don't want to have to fold it. It sucks. I know that sensory sensitivity is an issue for me. This kind of actually goes with that anxiety about going to unfamiliar places where there are potentially loud noises, there are potentially bright lights or too many people. So I avoid going to places like the mall or like the grocery store. I have successfully avoided going grocery shopping for myself for a few years. First, I was married to somebody who did it for me, and then the pandemic happened. And so ordering groceries kind of became the norm. So that made it a whole lot easier for me to not set foot in the grocery store. If I absolutely have to go to the grocery store, I need an emotional support buddy, which the same thing happened the other day. Actually, I needed to go to the Apple store, which is in the mall, because I needed to get my AirPods checked out. They were acting up and I wanted my son to come with me, but he was hanging out with his friends and he didn't want to come. And so the idea of me having to go to the mall by myself started to give me serious anxiety. I was like, oh shit, you're going off the deep end. Take a minute. And I texted my partner and I asked him if he would be willing to come with me. And thankfully, because he loves me so very much and because he's the best, he said yes. And what was great about it is that he also doesn't like being there. So he also very quickly wanted to get out of there. We did what needed to be done, got out of there as quickly as possible. And even though there were a lot of sights and sounds and smells and people, I didn't have a nervous breakdown. So that has to count for something, right? Speaking of shopping, I hate shopping. And I'm not talking about grocery shopping anymore. I'm talking about clothing shopping. There's that whole sensory overload aspect of it. Too many choices, too many colors, usually in a place where there are lots of people, but definitely bright lights at the very least. I don't like it. I can't do it. That's why I do 99.9% of my shopping online. But a huge reason why I buy only certain things, or I'll buy the same pair of pants in different colors or the same shirts in different colors. Actually, right now I am wearing one of two sweatshirts that I have in the same color because I fucking love it and never want to wear anything else. That has to do not just with comfort, but with decision making. If I know that something feels good, if I know that something fits well, fantastic. I don't need to be looking for other shit. I will buy the same type of clothing, the same style, the same cut until they stop making it. The other part about clothing is colors. I don't like colors. I don't know if that's a sensory thing or maybe it is a sensory thing because I really don't like fucking colors at all. I want things to be very plain. Almost all of my furniture in my apartment is black. My curtains are black. My rug is black and white and gray. Yeah, I'm looking around and everything is black. I really want to paint my walls white or maybe a really light gray or something because this yellow cream color that I have in my living room fucking sucks. But anyway, back to black. I find that keeping things simple when things are the same color, for example, if everything is black, everything matches, right? If everything is black and white and gray, odds are it's going to be really easy to find something to wear. I have learned that if I buy myself something that has a color or a pattern on it, I'm going to wear it a whole lot less or not at all, even if I think I like it. It just doesn't happen. I don't know why. I don't know what the method to my madness is. That's one of those things that will remain an unsolved mystery. Whatever. Speaking of things around my house, we can go back to that topic for a minute. I have tons of dead stuff around my house. I have skulls. I have some femur bones. I have some claws and articulated paws. I've got tails. I have some wet specimens. I have this really dope fetal pig that is cut in half so that you can see all of its insides. It's beautiful. It's amazing. I love it. I don't care what you think of me. You can say I'm weird. I already know. Come to my house. Check it out. It's kind of like a weirdo museum. Between all of the taxidermy everywhere, the weird artwork that I have up now, and all of the serial killer and forensic psychology books that I have, it'll be a blast. All right, so enough about all of the symptoms. Let's talk about what you can do about it and what I have done about it. I talked a little bit about how I was in therapy, then seeing a psychiatrist, and that was all because of my anxiety. And then I learned about potentially having ADHD and worked with them on treatment for that. So once I got my diagnosis from my psychiatrist, I spoke with my therapist about it. Make sure that you're telling your doctors stuff, share information the best that you can. Anyway, the other thing is if you feel like you need help, if you feel like you need some sort of accommodations, you can ask. In school, most schools have some sort of a disabilities office. And in schools, I mean colleges. As far as in lower level schools like high school and lower, it's usually the guidance office that you start going through that stuff with. But as an adult, if you feel like you may need accommodations in the workplace, you should go to HR. And the reason is because a lot of people in supervisory and management roles are not properly trained on what they are supposed to do, what the laws are, yada, yada. People that are in HR, it's literally their job to facilitate you getting the accommodations that you need. I'm actually in the middle of doing this right now because there has been a push for me to return to the office 5 days a week. And in the almost 3 years that I have worked there, I don't think I've ever been in the office 5 days a week. Maybe at the very beginning, right before the pandemic, but that lasted into, I started working from home in like February because my daughter got sick. So yeah, I've always had the ability to do hybrid even before the pandemic. And so that's how I've learned how to do this job, being able to split my day up. However long I'm able to sustain my focus, I do it. I sit down. Typically my routine is wake up early in the morning, get some shit done for a few hours, get the little one off to school, get some more shit done for a few hours, take a break. So having the ability to do that is really important. And because my job is primarily writing, it's been a really huge blessing to be able to do that. So I'm hoping that that'll be something that I will continue to be able to do. Unfortunately, though, I think I mentioned this before about how people don't really understand ADHD and how it works or what it is. So I do definitely feel like I'm treated differently because of my disability. Alexa, what is rejection sensitive dysphoria?
According to an Alexa Answers contributor, rejection sensitive dysphoria, RSD, is when you experience severe emotional pain because of a failure or feeling rejected.
So yeah, that's definitely an issue for me, especially at work, because that's what I spend most of my time doing. I feel like I'm looked at differently. I feel like because people don't understand what's going on with me, or maybe they just don't fucking care, I feel very rejected. I feel very self-conscious. I feel a lot of shame. Anyway, I can't wait to speak with my therapist about all of this next week. I do want to mention that cognitive behavioral therapy can be really helpful in finding techniques to manage the symptoms of ADHD. My therapist is fantastic. She is always giving me really great little tidbits and like homework assignments. I really appreciate that I have such a great therapist, that I have someone who is so knowledgeable about ADHD, and she's somebody that I chose before that diagnosis. So I've really lucked out Before I end this episode, I want to thank my mom, my dad, and my sisters for all of the support that you guys have given me, or just the small words of encouragement, or the conversations that we've had about ADHD, about mental health, about my podcast. It means a whole lot to me. And I also want to give a special shout out to someone who spoke with me about the types of medications that she's on right now and her experience with the medications that she's taking, because we both take the same meds, Adderall and Zoloft, and getting a firsthand account of someone's real life experience. She doesn't know me very well. The fact that she felt comfortable enough to be vulnerable and to share her experience with me was really special and incredibly helpful, because with what I'm learning and what I'm experiencing, it can feel so lonely between being a single parent, struggling with the PTSD and anxiety, and now this new diagnosis. Even though it has been helpful in a lot of ways, it still feels really lonely because there's a part of me that feels like nobody understands. And it's really wonderful to have people like my family and friends who get it. Also, I just want to say thank you to my partner. You do so much. Thanks for supporting me. Thanks for being there for the good shit and the bad shit, and being kind enough and patient enough and self-aware and all the things. You are amazing. You're one of the best people I know. And I am so lucky that you have chosen me and my weird, goofy, crazy ass. Thank you, everyone. My next episode will be about domestic violence. It's something that I have personally experienced, and it is also something that a lot of people that I love have experienced, and it looks different for everyone. So I think it's really important, especially because October is Domestic Violence Awareness Month, that I talk about all of the different types of domestic violence, as well as sharing some resources. Episode 3 will be about generational trauma. I spoke with my mom briefly about it today before recording this episode, and although she won't be a guest on my show, I will be speaking with her at length about all of the things that I'll be discussing to make sure that I give an accurate account of things, and because I feel like this kind of a conversation is a really important conversation for parents to have with their adult children. Alexa, thank you so much for all your help this evening.
Sorry, I'm not sure about that.
Alexa, I said thank you.
You are so very welcome.
Do you want to come back on my show?
Sorry, I'm not sure.
I'll ask you again another time.
Sorry, I'm not sure about that.
Just say goodnight.
Good night. Hope you had a great day. Goodbye.
Thanks for tuning in to Tea Time with Tara. Stay tuned, bitches.